due to time, I'm going to get us started here. Welcome again. My name is Amy Forbes. I'm the training manager from the Northwest Mental Health Technology Transfer Center, and I'd like to welcome you all to today's webinar, Mental Health Impacts of Climate Change, an overview presented by Dr. Kristie Ebi, Dr. Susan Clayton, and Dr. Shirley Harper. Please know this webinar is being recorded. A certificate of attendance will be emailed to those who registered and attended, and we are not able to offer CEUs for this webinar. I'm going to give a brief overview of our network and some important information before we get started. The MHTTC is a nationwide network supported by the Substance Abuse and Mental Health Service Administration, or SAMHSA. Our network includes 10 regional centers and a network coordinating office. And as you can see in the pink circle at the top of your screen, our Northwest MHTTC covers HHS Region 10, which includes Alaska, Idaho, Oregon, and Washington. Our goals at the Northwest MHTTC are to support mental health-related evidence-based practices, heighten awareness, knowledge, and skills of the behavioral health workforce, foster alliances, and address diversity of training needs, and also share free publicly available training and technical assistance. Our area of focus is in evidence-based practices for psychosis, including CBTP and assertive community treatment, or ACT. And at this time, if you've been in webinars with us before, I usually direct everyone to our website to check out all of our resources and our newsletter. However, since this is our last webinar together as the Northwest MHTTC, I wanted to take this brief moment to give you all our gratitude and heartfelt thank you for being here today and supporting the educational materials we've developed over the past 6 years. The MHTTC will be sunsetting at the end of September, and we've loved sharing these moments with all of you. So thank you so much for being here today, and thank you for supporting us throughout these 6 years. Now I'm going to get back to business. So for today's webinar, we will send a link to the recording, the slides, as well as your certificate of attendance within a couple of weeks. For communication during this event, please do use the chat box to reach our staff if you have any questions or concerns, or you would just like to share respectful comments, greetings, observations with everyone. Please use the Q&A box to type your questions for our presenters. You can do this at any point throughout the presentation. We will be monitoring the Q&A box to facilitate answering as many questions as possible at the end of the presentation. Also, at the end of today's event, we will send out a link to our survey. Please know that your feedback is still very important to us and the work that we've done, and very important to our presenters. We are required by SAMHSA to conduct this survey, yet they do not have an official position on our content. And now I'd like to welcome and introduce you all to today's presenters. Dr. Kristie Ebi has been conducting research on the health risks of climate variability and change over the past 30 years, focusing on estimating current and future health risks of climate change, designing adaptation policies and measures to reduce these risks in multi-stressor environments, and quantifying the health co-benefits of mitigation policies. She was a lead author for the 6th Intergovernmental Panel on Climate Change Assessment Cycle, edited 4 books on aspects of climate change, and has more than 200 peer-reviewed publications. Dr. Susan Clayton is the Whitmore Williams Professor and Chair of Psychology at the College of Wooster in Ohio. Dr. Clayton's research examines people's relationship with the natural environment, how it is socially constructed, and how a healthy relationship with nature can be promoted. She has written about the effects of climate change on mental health, and has developed a scale to assess climate anxiety. She is author or editor of 6 books and is currently the editor of the Cambridge Elements series in applied social psychology, and was a lead author on the 6th assessment report for the Intergovernmental Panel on Climate Change. And also we have Dr. Shirley Harper, who is a Canada Research Chair in Climate Change and Health, Cool Scholar, and professor at the School of Public Health at the University of Alberta. Her research investigates associations between weather, environment, and health equity in the context of climate change. She was a lead author on 2 intergovernmental panels on climate change with the IPCC reports, served on the Gender Task Group for the IPCC, was lead author on Health Canada's 2022 Climate Change and Health Assessment, and co-chaired the Government of Canada's Health and Wellbeing Advisory Table for the National Adaptation Strategy. So with that, I'm going to stop sharing and welcome Dr. Kristie Ebi, Dr. Susan Clayton, and Dr. Shirley Harper.
Thank you very much for inviting us to give these presentations that are hopefully going to help illustrate the challenges for mental health and our physical health from climate change. I'm going to give a broad overview, and then you're going to hear from 2 experts around how mental health is being affected by climate change. So thank you very much. Really appreciate the opportunity. And I'm going to turn off my camera. I've got a little bit of a bandwidth problem, and do let me know if the audio gets distorted, but at least turning off my camera will make it a little bit easier. I want to start with the framing on the left. And this is a framing from the Intergovernmental Panel on Climate Change, the IPCC. The framing is used across all sectors. And it basically says that as we look at a changing climate, we're looking into the future. And when we think about the future, we think about risk, where risk is probability times consequence. In the framing of the IPCC, risk is composed of 3 factors. I'll turn that into 4. The first are the hazards created by a changing climate. The second are the human and natural systems exposed to those hazards. And the third is the underlying vulnerability of those systems. For human health and well-being, makes sense to separate out susceptibility to harm and the capacity to manage. It's important to understand this framing because when we think about climate change and health, it's not just climate change. It's about other things that are changing as well. The figure on the right is one of probably 100 figures that shows the various ways that a broad range of factors interact with climate change and then affect the exposure pathways that we are used to in environmental health. As I said, there's many other kinds of graphics, but they all fundamentally show the same thing. I will comment that the examples of health outcomes are a very short list. There are hundreds of climate-sensitive health outcomes. A key challenge in this field has been underinvestment. I understand that all scientific disciplines say they don't have enough money, but frankly, there's been essentially no money. And so there's a lot more questions than there are answers. Looking across the research that's been done, about 2/3 of it's been done on heat. You'll hear about the research that's been done on mental health. And for those of you who are researchers, there's so many opportunities to do more research in this field and come up with new insights. These are the key conclusions of the IPCC, Intergovernmental Panel on Climate Change, Human Health chapter that was published in 2022. The headline statement on the left that climate change is already adversely affecting the physical health of people globally and the mental health of people where there are data. In light blue are the categories in which the assessment was conducted. And for each one of these that I listed, there is very high evidence, there's robust evidence that climate change is affecting the health consequences, for example, of extreme heat events. The right-hand side are the projected risks. There's fewer studies that project changes with development and with climate out to mid-century and beyond. But for the ones that are listed, there is robust projections that additional climate change is going to cause even more harm. Health is in a different situation than many of the other sectors in that essentially all the health risks of a changing climate are current problems. We're going to see infectious diseases in new places, new seasons, longer duration, greater intensity of transmission, but much as what is known about who's vulnerable to many climate-sensitive health outcomes is pretty well known. On the left is a figure from the National Climate Assessment that came out in 2018, showing some of the more vulnerable groups. In black, it lists some of the actions that can be taken to protect these particularly vulnerable groups. And on the right is the beginning of a discussion you hear throughout our presentations, is that at its core, climate change and health is about equity. This figure is specifically about heat and health equity, but it's true for all of the health outcomes of a changing climate, that those who contributed the least to greenhouse gas emissions are the ones who are being harmed the most. And even within high-income countries, it's the poor and the marginalized communities that are affected greater by a changing climate than people who live in wealthier regions. I'm going to run through a few examples of kinds of concerns we have with climate change. I will start with extreme weather and climate events because I presume those are on everybody's mind, given how many are going on even now as we speak in the US and the rest of the world. Every year, NOAA, the National Oceanographic and Atmospheric Administration, tracks what it terms are billion-dollar disasters. The figure shows the $28 billion disasters in the US for 2023. As you look at these, the point I want to emphasize strongly is these are economic losses. They're not losses of human health and well-being. There's no heat waves here. That's why I put the number on the left. In 2023, more than 47,000 Europeans died in heat waves. And so when you see these kinds of numbers, see how large they are, bring to mind that they're just a fraction of the total impact of these events. As I mentioned before, much of the research has been done on heat. When we think about how heat affects our health and our well-being, the focus is on our core body temperature. This is not the temperature one measures with a thermometer, but it's our core body temperature. Our core body temperature needs to stay within fairly narrow range to protect our cells and our organs. Our core body temperature fluctuates throughout the day. We may exercise, we get hotter, we may do physical activity outdoors, we get hotter, but then we go places where we can cool down. And so the body can tolerate these changes in our core body temperature throughout the day. We have behavioral and physiological mechanisms during heat waves to keep that core body temperature down. But if those are insufficient, then our core body temperature starts to rise, which basically says we're starting to heat our cells and our organs. After a heat wave, about 50% of all the excess deaths are from cardiovascular causes, indicating not only a high burden of cardiovascular diseases in the population, but also the susceptibility of the heart to that additional heating and how that can lead to devastating consequences, including mortality. Because of the understanding of these mechanisms and of the variety of ways people can protect themselves, essentially all heat-related deaths are preventable. Exposure to heat waves increasing. These are data from the Lancet Countdown, giving some pretty large numbers of the number of heat wave days that people are being exposed to now as opposed to 20 years ago. And that is going to continue to rise with the increasing temperatures. Heat waves, I of course will use the example of the heat dome that occurred in the Pacific Northwest. This is a map that I took from the New York Times, which is why it's in degrees Fahrenheit. For those of you who use degrees Celsius, I apologize. If you follow meteorologists, you know that typically, whatever location you live in, when it breaks temperature records, basically does it by tenths of degrees. The heat dome broke temperature records by 10 degrees. At the time, that was unheard of. You can see the broad distribution of this heat event. And over the course of the 4 or 5 days of the event, just in the state of Washington, there were more than 440 excess deaths. Because there was a detection and attribution study that concluded this event was virtually impossible without climate change, these deaths are because of climate change. As a public health professional, these kinds of studies are very powerful. Instead of saying we know there's an association between heat and mortality, we can start now counting the number of people who are dying from climate change. It was obviously a very significant event, but there's been other events. There was an event in the Scandinavian region a couple of years ago where the Swedish Meteorological and Hydrological Institute decided that that heat wave had a return period of 1 in 3 million years, which I actually can't quite wrap my head around. There was another event in Japan where their meteorological agency said it was just impossible without climate change. Unfortunately, these are going to become more common, and you'll hear a little bit about the mental health consequences of exposure to high temperatures. I mentioned there's a broad range of actions that individuals can take. These two infographics are a nice summary from a paper from Ollie J. that was published in The Lancet. If you go to The Lancet, look for Heat and Health series, you'll find these infographics. They're being widely used and modified. Their information is being taken from these and are modified for the local context and are being used in a variety of heat wave early warning and response systems to help people understand what it is they can do to protect themselves. If we were in person, I'd ask how many people have allergies or asthma, usually at least a third. And our springs are coming sooner, fall starts later, and higher carbon dioxide is leading to more pollen. The figure on the left is an old figure from the early National Climate Assessment in the US, showing that ragweed pollen season is now a month longer. And the top right shows you grass pollen has increased significantly and will continue to increase with more carbon dioxide. I'll talk about that a little bit more later. It's not just the pollen, it's also the poison ivy, if any of you live in a place that has poison ivy. Vector-borne diseases are always a topic of interest. I'm not going to go through this whole slide. It's here just to make the point that temperature and precipitation affect the development, survival, and reproduction of a wide variety of pathogens, and the temperature precipitation affects the vector, the mosquito, the tick, and temperature also affects the replication of the pathogen and the transmission of that pathogen. So the modeling is a little more complicated than in other places because you have to take both sets of interactions into account. And despite the complexity of all of this, it is quite clear that there's a number of vectors that are changing their geographic range and their seasonality. These are data from Eastern Ontario over just 6 years, showing the large increase in the spread of human Lyme disease incident in Eastern Ontario. It's one of many examples where we're seeing climate change is facilitating the spread of a variety of infectious diseases. Looking into a warmer future, this is an iconic figure from the Intergovernmental Panel on Climate Change, focusing on hot temperature extremes over land. showing that from 1850 to 1900, for the 1 in 10-year event, 1 in 50-year event, of course, that event occurred once. We are now at about 1.2 degrees Celsius warming above pre-industrial. So for the 1 in 50-year event, we're probably 6, 7 times more frequent for a 1 in 50-year event. And as I said before, it's not just 1 in 50-year event. That Pacific heat dome was a more than 1 in 150-year event. So we're seeing not only more heat waves, but much more extreme heat waves than we experienced in the past. Heat, as I mentioned, kills needlessly. This is a projection of heat-related mortality at the end of the century. And I chose this particular study because it looked at the number of possible deaths under 4 scenarios. 2 of them in which there was adaptation to higher temperatures, where early warning systems were implemented, where there was acclimatization on the physiological level to heat. And so taking into account that people will adapt as temperatures get warmer. The other set is low or high emissions. These are greenhouse gas emissions. And I put this in to point out, if you look at the upper left, no adaptation, high emissions, the bottom right, adaptation, low emissions, those are 2 very different worlds. The choices we make individually and collectively are going to affect which of those worlds we're going to be living with towards the end of the century. I think one of the biggest health risks of a changing climate is going to be through food security. There's 2 mechanisms for that. This shows you the first, which is the effect of climate change, primarily increasing temperatures, on crop yields. There's maize or corn, rice, soybean, and wheat. I'm not going to talk about soybeans because they're completely different. The top row, yield change in mid-century, bottom row, yield change at the end of the century. And these are under different greenhouse gas emission scenarios. But mostly you just can look at the patterns and see large declines in crop yields. And the largest declines, of course, are in places that are the most food insecure today. The other pathway is through carbon dioxide itself. All of our plants use a photosynthetic pathway to bring in carbon dioxide from the atmosphere, use that carbon dioxide, and break it into carbon and oxygen. And the carbon is then used by the plant to grow. The oxygen, of course, is released out to the atmosphere. When you look across the plant kingdom, there's only a couple of photosynthetic pathways. 85% of our plants use one photosynthetic pathway. And biochemical characteristic of that pathway means these plants are called C3 plants. That's all it means, particular photosynthetic pathway. This includes wheat and rice, which together are almost 50% of the calories consumed around the world. Barley, potatoes, grasses, trees, 85%. Based on field studies with wheat and rice, there's quantification of how higher concentrations of carbon dioxide promote plant growth. What you might not hear if you read about this from the skeptical press, where they talk a lot about carbon dioxide as plant food, which it is that it also changes the internal structure, content of the plant. That plants have more carbon-based molecules, so they have more carbohydrates, and they have less nitrogen-based molecules, which is why there is about a 10% reduction in protein and about a 30% reduction in B vitamins. Through another mechanism, there's about a 5% reduction in micronutrients. There's over 800 million people in the world who are food insecure. There's about 2 billion that have got micronutrient deficiencies. And this form of undernutrition is termed hidden hunger, which is what's on the right. Was there a question? One issue that's quite important, becoming more important on the agenda, are the compounding and cascading risks. The figure on the left is a nice example of the way a whole range of different factors can interact with our changing climate and affect infectious disease, food, fuel, water shortages, other issues. On the right are some examples in the health sector. There will be more learned about this as more research is conducted. There are many effective adaptation options. I'm not going to go through all of these, but can talk about those in the Q&A if they're of interest. Of course, the most important adaptation option is to strengthen the resiliency of our health systems. We've been saying this for years. COVID's made it even clearer how important that is. And at the bottom is a note that the major constraint is limited investment. Looking until December, looking at the investments under the international funds for adaptation to climate change, less than half of 1% has gone to health. So at the same time, people are suffering and dying from climate change. Ministries and departments of health don't have the human and financial resources needed to be able to address those challenges. Every other year or so, the World Health Organization surveys its member states. In 2021, 95 countries responded. Of those, half had some kind of vulnerability and adaptation assessment, the first step to understanding what needs to be done and prioritizing actions. But in looking into the countries that did respond, only 9 reported that the findings strongly influenced resource allocation. So much needs to be done in this space to protect our health and our well-being. I wanted to finish with a comment about mitigation, which is reducing greenhouse gas emissions. Lots written about the absolute critical need to reduce our greenhouse gas emissions. But what is often not as well understood is there's health benefits from mitigation policies and technologies. There's lots of benefits. The summary of all the studies is that when you look at the avoided hospitalizations, the avoided premature deaths from various mitigation policies, the benefits of those avoided deaths and hospitalizations are of the same order of magnitude, if not larger than the cost of mitigation. We should be mitigating for our health. I put this example in mostly because I really like the photograph. It was a very well done study of just shifting 5% of short urban car trips to bicycles and all of the savings in terms of mortality, in terms of healthcare costs. About 85% of the health risks of a changing climate are in children. So I hope that when you think about climate change and health, you'll keep the children in mind because we do need to protect their futures. Thank you very much for listening. And I very much look forward to comments from Susan. I believe you're next.
Thank you. Thank you. I like Kristie, just really happy to be here with you all today. Why, when I tried this earlier, this was working. Now it's not working. Oh, I know why. Sorry. Sorry, just a second. Having trouble sharing my file, my screen here. Apologize for that delay. So yes, thanks. I'm really happy to be here talking about this important issue. I'm also happy to have been starting off by listening to Kristie because I always learn something new and important by listening to her describe the different health impacts. My goal today is to focus in a little bit more closely on mental health impacts of climate change, something that many people have not yet given much thought to, but for which we have increasing evidence for them occurring and increasing evidence for concern. And I want to start with this diagram that essentially says some of the ways for us to understand how climate change can affect mental health can be more easily recognized if we look at different levels of impact and different levels of processes I know this the font may be a little small for some of you to see, but the outside is has been described as the chronosystem. That's where you get the climate impacts. That's where you see the changes in water level and temperature and extreme weather. Within that, we have a level called the macro system. Sorry, yes, make sure I'm in the right place, which is essentially the culture. How are cultures affected by the changing climate? Some of those ways, and you might hear more about this later, are disrupted traditions and experiences of spiritual or religious losses. Within that, we have the societal level. How are climate changes being expressed through things like different patterns of migration or resource disruption? Within that, we have communities. What are the employment stresses that might be experienced? How is physical infrastructure affected? Even within that, we have the microsystem, which kind of gets at individuals' experience in their own lives and their own families and personal relationships. So this is an example of how you might see these cascading impacts of climate, all of which might, in the middle, be represented by the ways in which individuals respond, certainly through physical health impacts, but in this case, I'm focusing on the mental health and well-being. And I want to just say that mental health, when we talk about mental health, we can be thinking about mental illness, but mental health encompasses other aspects as well, as per the World Health Organization definition, really includes maximum functioning. And if we think about, well, how is it that climate change can start to have impacts on mental health? I break this down into 4 channels. I think when I started, it was only 3. It's kind of expanded. And these range from maybe the more concrete to the more abstract, but also tend to start with the ways that we've been studying for longer and end with ways we've been studying for a shorter amount of time. So for many people, when they think about climate change, it's really the acute impacts, acute events that come to mind. The major storms, the wildfires, the floods. But of course, climate change more insidiously and more permanently is associated with these slower changes, but that are nevertheless occurring in a linear way, that are getting worse over time, like increased temperatures, rising sea levels, impaired air quality, loss of biodiversity, and so on. Then again, these kinds of impacts that I have called here indirect, but which you might also describe as the cascading impacts. How does climate change lead to displacement? How does it threaten physical health? And how does it threaten economic well-being? All of these, of course, having impacts on mental health. And then the last most abstract category refers to the ways in which people think about climate change, their perceptions of the problem, and how that might lead to an anxiety about an uncertain future. And perhaps some of you, having heard more about the health impacts, are already feeling increased levels of anxiety. So as I say, we've been studying the effects of extreme weather events for a long time, these acute impacts, and there's a very solid body of evidence about the impacts these kinds of events have on mental health. You see increased rates in post-traumatic stress disorder, depression, general anxiety as some of the most common responses, also increases in suicide and suicidal thinking, misuse of drugs and alcohol, sleep disorders, and even interpersonal violence all tend to go up after extreme weather events. So, for example, Hurricane Maria, one that is relatively recent, but long enough ago so that we have a fair amount of evidence. You saw a doubling in the rate of post-traumatic stress disorder, significant increases in suicide medication, psychoactive medication, and mental health services in general. And one thing that we've seen really, maybe even just in the last 5 years or so, was a rapid increase in both the quantity of evidence and the quality of evidence we have about some of these impacts. So there's been a lot of interest in and research on the impacts of wildfire, especially in North America. If you remember the California Camp Fire, there was a tripled rate of post-traumatic stress disorder, almost doubling in anxiety or depression. And this was predicted most strongly by direct exposure, people who really personally experienced, say, a loss of their home, a displacement. But indirect exposure, just knowing people who had also been displaced or harmed, also predicted increased anxiety and depression. And then more recently, a kind of systematic study of many wildfires over multiple years, including over 7 million people, found a statistically significant increase in psychoactive medication over that period, but not in other kinds of medications that were used as a comparison. So you really did have this concrete evidence for increased mental health problems associated with the wildfire. And one of the reasons, I mean, of course, we care about the impacts of events like this, but an additional reason to care is that the impacts can be long lasting. So it's not the case that a week later, 2 weeks later, a month later, 6 months later, you're necessarily back to normal. The Alberta wildfire, for example, was extensively studied over multiple years and found significantly elevated levels of mental health problems a year after the wildfire continuing. And when we start to think about these long-term impacts on mental health, I really want to highlight the need that Kristie kind of ended with to be concerned about children. Because again, there's increasing evidence for long-term and potentially lifelong impacts on children of exposure to this kind of traumatic event on adult mental health, for example. So impacts definitely last. Now, again, as Kristie was saying, we've kind of moved beyond just thinking about these extreme events to a greater focus on the chronic changes, in which I'll primarily highlight heat, higher temperatures, and air pollution. And there are several reasons why this is, I think, a significant change in focus or a significantly expanded understanding of the impacts. One is that not all of us are exposed to extreme events, extreme weather events, but a far greater proportion of people are exposed to higher temperatures or lower air quality that are associated with climate change. Also, these events, you can examine sort of not just the outcomes associated with them, but also begin to think about the neurological implications. So both of these things, heat and air pollution, can be seen as having direct impacts on the brain, right? So the brain responds to higher temperatures. There might be inflammation, there might be impacts on the mental processes of really at a chemical level associated with these higher temperatures. Same thing with air pollution. It gets into our brains. I'll just say very, very broadly. And there's a lot of research on heat, again, because we didn't necessarily, heat is of interest even before climate change. Also, you can do controlled experimental research in which you vary the exposure to heat for looking for short-term impacts. But increased large data sets have shown that higher temperatures are associated with increases in suicide, in psychiatric hospitalization, decreases in happiness and positive mood, increases in aggression and conflict. And of course, I think many of us are aware of the effects of heat just on your ability to function. Particularly for people who work outdoors, we increasingly recognize we can't ask people to work during the middle of the day if it's 110 degrees outside. So there are parts of the world including some parts of the US, where people are getting up at 3 o'clock, 4 o'clock in the morning so that they can put some hours in before it gets too hot. And mental functioning is also affected by heat. And you see increased research on how students who go to schools where there is no air conditioning are not going to be able to perform as well on exams, for example. Again, air pollution associated with cognitive decline and neurodegenerative diseases because, your brain is just a very sensitive organism. And when things start to cross the blood-brain barrier, you start to see impacts. The indirect impacts of climate change, these sort of downstream effects, there are many, but the three I want to highlight, and I think Kristie also talked about at least several of these. Involuntary displacement. So people migrate for all kinds of reasons, but one of those reasons is due to climate change, that the place they live may literally become uninhabitable, or it may be less appropriate a place to live. Maybe if you're involved in agriculture and the agricultural conditions become much less favorable. We see a lot of that in Central America, for example. So some people migrate because they want to, but some people migrate because they have to. There are a lot of economic conditions that are affected by climate change. There's a lot of talk these days about, for example, the coming crisis for real estate, as many people realize that their homes are not going to be sellable or going to be very difficult to sell because they're in places, coastal areas often, or places that are otherwise affected by climate. And so people are going to lose a lot of money on their home equity. Also, your job might be threatened, or if you experience an extreme weather event, you have to put money into rebuilding and so on. And then, of course, the food insecurity that Kristie went into. All of these are associated with mental health problems. There's lots of research showing, of course, migration is stressful. If you are a refugee, the conditions before you migrate are stressful. Making the decision to migrate is stressful. Migrating itself is stressful. And then when you get to the new place, you're often resented by those who are already there, or perhaps even there's conflict. So immigrants are at increased risk of mental health problems. And this is true even among second-generation immigrants because they still haven't fully assimilated in many cases. Economic insecurity is associated with depression and anxiety. We can feel somewhat confident that there's a causal mechanism because if you put in anti-poverty programs into place, they decrease those mental health problems. And again, thinking about impacts on children, experiencing poverty in childhood or even while you're before birth increases risks to cognitive development and also adult mental illness. And food insecurity, again, lots of research here that it shows that food insecurity is associated with worse mental health. This is true across the world and independent of socioeconomic status. So maybe you're relatively well off, but for whatever reason, or maybe not well off, but you're not in dire poverty, but you're experiencing malnutrition for some reason, perhaps because of the lower nutritional value of your food or because of increased difficulty having access to that food, it will still be associated with worse mental health. So it's not just about being poor. Again, children, food insecurity among children. Many of you are probably aware that there are so many ways in which children go through critical periods. Impacts that they experience during development are essentially irreversible or not completely reversible. So food insecurity while you're a child is associated with higher lifetime rates of depression. And again, even after controlling for your income level, food insecurity is associated with just less positive well-being, lower life satisfaction. So getting to the more abstract aspects or the more abstract experiences of climate change, what does it mean? How does it affect us simply to be aware of this problem? And here are some quotes I've heard, over the past 4 or 5 years from people, including climate activists. I felt stress, panic. I was depressed. I stopped eating properly. I would freeze. These sound very much like people who are experiencing mental health problems. These are not insignificant kinds of comments. They're feelings about climate change are beginning to impair their ability to function in the world, to move, to control their emotions, to eat, to work, etc. So I've been looking at climate anxiety, which I just define as a state of anxiety about climate change, essentially. And as was mentioned in the introduction, developed a measure to look at this. About 20% of people in the US report that climate anxiety affects their ability to function at least some of the time. So that may be a low bar, but it's a significant number of people. Worldwide, you see that climate anxiety is associated with standard clinical measures of anxiety and depression and a negative relationship with well-being. And that's what this figure shows, a graph showing in different countries the extent of the relationship between rate of well-being and climate anxiety. So you can see different countries, but they're all negative correlations or negative relationships. So I want to encourage us to think broadly, not just about climate change, but also about mental health and the variety of ways in which well-being can be affected. I already mentioned cognitive functioning, learning and cognitive performance. Also, prenatal stress can affect those things. Social relationships can be impaired by climate change. And I think maybe Sherry will talk about that a little bit. But if our social relationships are impaired, that's a very important part of health and well-being. And again, not just mental health, but physical health. And individual behaviors can be impaired by these stressors and anxiety. And this is data from a study that is sort of just been accepted, and I hope will be appear within the next month. A sample of 15,000 young people in the United States. You see more than half and more than 2/3 in some cases saying climate change is going to affect these major decisions I'm making about my life, where I choose to live, how I plan my future, how much effort I put into my education, whether I have children. So thinking about the impacts of climate change on people's long-term planning is something that I think is important to bear in mind as we think about these impacts on mental health. Just a few words to wrap up. Negative effects are not inevitable. One of the great things about mental health is it's not deterministic. There are a variety of things you can do to help people to be resilient. Certainly, to the extent that we can reduce the extent of climate change, to the extent that we can mitigate it, that will help. But there are also adaptive strategies we can use, as Kristie referred to, more access to mental health care, more training about how to respond to, for example, extreme weather events, more culturally appropriate, climate-specific mental health resources that are attentive to impacts on diverse communities. And when we think about what it means to be resilient, we definitely want to think about how to promote individual mental health. A variety of, clinicians, mental health practitioners have given a lot of thought to this. Some of it is going to be very specific to climate change, some of it less so. So encourage people to think about their own emotional well-being, but also maybe to focus on the problem. If you're anxious about climate change, maybe getting involved in addressing climate change will actually promote mental health. And some people have started to talk about the role of meaning-focused coping. So if the problem doesn't go away, but you don't want to deny it either, you can focus on finding meaning in addressing it, finding meaning in coming together with other people to work on improving the climate. And so finally, we can't just focus on individual well-being. When we think about mental health and climate change, we also need to think about collective well-being. How can we promote healthier societies in the face of these challenges? And here I would emphasize things like social support for talking about climate change, education about climate change, and again, policies that provide greater access to and funding for mental health care. And I don't want to take more time than I have, so I'm not going to go into this slide, but I am going to say there are things the mental health field can do to prepare for the current and increasing impacts of climate change. And this slide will be available to all those of you who are attending. So I'll stop now and pass it on to Shirley Harper.
Awesome. Thank you so much, Susan and Chris. That was amazing presentations. And I think that you set the stage really nicely for me to go into some examples of what this looks like. And my examples are in the Canadian context. So I'm going to share my slides here. I'm calling in today from Edmonton, which is in the province of Alberta in Canada, in Treaty 6 territory. So I'd like to start by picking up on something that both was mentioned in both of the past presentations, and that's the Intergovernmental Panel on Climate Change. It's hard to talk about climate change without mentioning the IPCC, which is under the World Meteorological Organizations and UNEP. And its job is to assess the science on climate change. And in the last Working Group 2 report on impacts and adaptation, it might not surprise you to see that this was one of the main findings of that report. So basically, we know that climate change is a threat to our own health and well-being and also the health and well-being of the planet, and that we need to start taking action. And you know, I have to say that it's easier to talk about climate change in the past, even the past 5 years, because people are increasingly having firsthand experiences with climate change. And we saw lots of examples of that in the past presentation, whether it's heat waves or wildfires. People are increasingly getting the sense of what climate change means, what it looks like, what it feels like, and it's impacting every part of our life. It's impacting our infrastructure, our culture, our livelihoods, our economy, everything that we care about, including our health. And it's impacting billions of people around the world. And I would even argue that it's already impacted each and every one of us, all of us on this call. Climate change has touched our life in some way. And it's impacted the health of millions of people. So in the Working Group 2 report, this was one of the main findings, that this is already happening. Sometimes when people think about climate change impacts on health, they think that this might be something that's happening in faraway places, so maybe not in North America, for example, but it's happening here and now. Sometimes people also think that it's something that's only going to be happening in the future, and maybe we should just be worrying about this mid-century. But again, one of the main conclusions in the IPCC report is that these impacts on health are already occurring now. And we also know that there are hotspots of high vulnerability. And Chris mentioned this in her presentation with that sort of propeller-looking diagram from the IPCC, looking at how risk is created. One of the main findings was that billions of people around the world live in these areas of high vulnerability. And if you look at the report's findings from a mental health perspective, these are some of the communities or groups of people that were identified as high risk or highly vulnerable to climate change impacts on mental health. So that includes people who are reliant on the environment for subsistence and livelihoods, especially Indigenous peoples, those with underlying physical or mental health challenges, those who are already facing socioeconomic inequities and marginalization. And of course, all of these things are dynamic characteristics that intersect in different ways, and they vary by genders, by age, by occupation, and a number of other characteristics. So, for example, for wildfires, obviously, if you are a first responder or a firefighter, you face increased risk of different mental health outcomes. So I wanted to spend my time sort of picking up on the last two presentations to illustrate some of these things through two examples. One are the wildfires that we've experienced here in Alberta, which was mentioned, I think, in both presentations. And the second example is eco-anxiety in the Arctic, or climate change and mental health actually in general in the Canadian Arctic. So to go into wildfires, just to, again, take a step back to set the context, we know that wildfires impact our health. The IPCC report made that very clear. And there has been some work done in Canada, published by the Public Health Agency of Canada and Health Canada, that found, short-term and long-term exposure to wildfire smoke in Canada is causing hundreds of deaths a year. And the long-term exposure can be even thousands of deaths per year. And that doesn't even take into account the non-fatal cardiorespiratory health outcomes that are associated with that. And people often focus in on that because number of deaths obviously are terrible, and physical health is really important to us, but it also has impacts on our mental health too, of course. I live in a province, Alberta. It's sort of like the Texas of the United States. It's oil and gas producing. It has very similar geopolitical context as Texas, just to give you a sense. So people are often curious about the economic costs of climate change in Canada related to wildfires. Well, we know that acute health impacts cost millions to billions of Canadian dollars per year. The chronic health impacts related to wildfire smoke are billions of dollars per year. And the largest economic impacts are in the provinces of British Columbia and Alberta. And if you look at the most expensive Canadian disasters over time, this could be climate change related or not, the two top most expensive disasters in Canada both happened in the province of Alberta, and they're both wildfire related. One was the 2016 wildfire in Fort McMurray, which was attributed to climate change. A number of studies actually had looked at that and done attribution work on that. And then the second most expensive disaster in Canada's history actually just happened less than a month ago. And that was the wildfire in Jasper. Also in Alberta, incredibly expensive. And there has been a little work, and I think there'll be more work forthcoming on this, attributing that to climate change as well. So these are incredibly costly disasters with wide sweeping physical health impacts, but also mental health impacts. So another important thing to note is that, of course, there's baseline health risks, both respiratory and cardiovascular. So these are two examples from Alberta. We see that before the wildfires, there's like a baseline level of daily physician visits. During the wildfires, we see this increase quite substantially, actually. And sometimes people might think that after the wildfire that those will go back down again, but what we actually see is that post-wildfire, these continue to increase because of the lingering physical health implications of the wildfire smoke. If we look at a specific example, the 2016 Fort McMurray wildfire, as Susan had mentioned, there's a lot of research that has actually looked at the mental health impacts of this wildfire in Canada. The most costliest disaster in Canada's history. There were about 88,000 people who had to be evacuated rather abruptly. It wasn't something that was planned for or that had happened in the future or that households even had a sense of what to do. So the evacuation happened quite quickly, and it was the first time that the province had to coordinate something of this scale and magnitude. There are several studies showing that the Fort McMurray wildfire evacuees experience increased rates of depression, PTSD, and insomnia related to the fire. But we also know, as Chris had mentioned, that there are disproportionate impacts on our children. And so there are quite a number of studies that looked at this for the Fort McMurray wildfire, and it doesn't matter really what mental health outcome you're looking at. After that fire, we saw an increase in different mental health rates in children in those areas. One study found that almost half of students met the criteria for one or more probable diagnosis of PTSD, depression, anxiety, alcohol or substance abuse, whether or not they were present at the fire. And that just shows like Susan was talking about, that you don't have to be the one who was evacuated or had firsthand experience of the fire. Just having that impact on your community to people who you know and love has obvious mental health impacts as well. We also know from research that the greater impact your family or household has from the fire, the greater adverse mental health impacts that family will experience. So there's a bit of like a dose response curve there. And we also know that after the wildfires, those factors don't go down, they don't linger, but they actually get worse over time. So that was an example from the Alberta wildfires. Now I want to shift to a completely different context, and that is the Arctic. And I'm going to touch on research actually both from Canada, the Canadian Arctic, but also Alaska as well. So just to set the stage a little bit, many people who live in the Arctic are Indigenous, and they have close connections to the environment. In both of the past presentations, food security was mentioned several times. So I wanted to carry that example forward in my presentation. So I'm going to go through a series of studies that were used in the IPCC's SROC report, the special report on the cryosphere and ocean, which included both, more like Western science information, but also Indigenous knowledge to conduct that assessment. So these are some quotes from some elders in the Canadian Eastern Arctic and Nunatsiavut, where people just talked about how the ice and snow have been changing and the impacts that that's had on their lives. So the ice for many communities in the Arctic is like the highway. That's what you travel on to get to another community or to get to a hunting ground or a fishing location or to a cabin. That ice is really, really important for transportation. And with climate change, people are already experiencing how the ice is no longer predictable, it's unstable, people don't trust it. People talked about accidental death, falling through the ice, and how people, they feel that people are literally jeopardizing their lives just going out on these unstable elements for transportation, but also for food security, to access food. This is a figure that's from Alaska, and basically what they found is that if people reported changes in travel plans, the odds of hypothermia and frostbite increased, and if people reported experiencing unusual weather when they were out on the land, unintentional injury also increased as well. So we also used more quantitative epidemiological information in that IPCC assessment as well. And it's not just, the animals that people hunt or the fish that people are fishing that are impacted by climate change. It's also the different types of vegetation and berries. And this is a quote from another elder, again, from the Eastern Canadian Arctic, reflecting on a year where they didn't really have very many berries. And through this quote on the screen, you can see that when people spoke about climate change impacts on food sources, they really they spoke about it from a very personal perspective, and during the interviews, a lot of tears were shared because this is a very, very, very stressful phenomenon that people are experiencing on a day-to-day life. Basically, if you can't go out on the ice to access food, like caribou on the screen, that impacts not only your food security, but it also impacts your cultural identity. It impacts, like your purpose in life. It impacts your entire family. It impacts your ability to bring food home and literally put it on the table. There are a lot of really complex mental health impacts associated with this. And it's not just the food on the land that people really rely on. It's also the food in the grocery stores. I often hear that, well, if you can't go out on the land to get the food, just go to the grocery store. That should be a good climate change adaptation strategy. Well, of course, it's not that simple. Food in the grocery stores, first of all, are incredibly expensive because they're mostly flown in. And that means that they're expensive, but they also have really long shelf lives. So they're not that nutritious or healthy. So they're hard to access for a number of reasons, but one of which is climate change. The changing weather, things like fog, storms, all these things that interrupt flights have actually increased in a lot of areas in the Arctic, which impacts people's ability to literally fly in food into grocery stores. And there were a lot of stories of where the weather had been bad for weeks on end and stores were literally running out of food and key supplies. So, there are lots of complex mental health responses in the Arctic in particular, ranging from, different emotional reactions that are very normal and healthy, like sadness, fear, anger, distress, and anxiety, but can also impact functioning and cognitive ability. So that's things like depression, PTSD, or generalized anxiety. But also experiences with loss and grief. If you're no longer able to practice certain cultural activities or pass on certain types of Indigenous knowledge as the climate and environment are changing, as landscapes are changing, as permafrost is thawing and things look different, people are experiencing loss and grief. There's also been some work done looking at alcohol and drug use, family stress, domestic violence, and suicide ideation related to the inability of people in the Arctic to get out on the land due to changes in ice and snow. So those are two examples from Canada. And if I were to pivot back to the IPCC report for a second, we know that there are things we can do to adapt and to respond to some of these changes. A lot of those were outlined in the past two presentations. But I just wanted to point to the idea that not all of these things happen within the health sector or the mental health sector. So certainly, I think that heat plans, early warning systems, those are very, very important in the context of mental health, not just physical health, but mental health as well. But also there's a lot of things we can do outside of the health sector, like improving food security, increasing access to green space and blue space. There's some increasing evidence that things like climate cafes, which aren't always sometimes, but aren't always intended to be a mental health intervention, could actually be really supportive in the and positive in the context of climate change. So there are things that we can do even outside of the health sector to have positive impacts on mental health in the context of a changing climate. In the IPCC report, we did look at the effectiveness of different mental health interventions. And we certainly know that there are a lot of different mental health treatments or responses or things we can do to support mental health and wellness in general. And we're assuming that a lot of those will be successful and effective in the context of climate change as well. But this is an area that needs a lot more research. There aren't a lot of studies that look at how effective these different types of interventions or strategies are in the context of climate change. So I think a lot more work needs to be done on that. And I expect and suspect that we'll start to see that increase in the future for sure. But one thing that we definitely know is that mental health risks are becoming more complex and therefore more challenging to manage against the backdrop of climate change. So with that, I'll end there. And I think that now is when we pivot to the discussion and the Q&A. I'm really excited to hear what your questions are or your comments. I see that there are some in the Q&A box popping up. Really looking forward to this discussion.
Thank you all so very much. Oh my gosh, my mind is absolutely racing with so many things. Kristie, you have your hand up.
I would like to add something to
Absolutely.
excellent presentation, which is some of the work I did in Western Canada, is the concern about the native medicines and with carbon dioxide fundamentally shifting the content of plants. There's lots of concern about not only access, but how do you know how much to give someone when you don't, frankly, often know the active ingredient, you don't know how it shifted, And there's lots of concerns in that space as well. So just wanted to add to Sherry's presentation.
Thank you so much. We have a couple of questions that I'm going to go right into. And everybody, please feel free, if you do have other questions, go ahead and type them into the Q&A. And we'll start off with the first one. What kinds of things could we watch or listen for when we're providing mental health services that might indicate a person is experiencing climate-related stress?
I'll jump in and take the first go at that. I think people might not even recognize that they are experiencing climate-related stress, so it's hard to say. I think one of the most important things that a clinician or mental health professional can do is to kind of provide space for the person to talk about that, and certainly if they say anything along those lines, maybe allow them to. Some people have reported getting shut down by mental health professionals with the implication that they're overreacting or they shouldn't be so concerned. So giving them space to express their concerns about the climate, I think is one of the most important things. And it could be that somebody says just in an offhand way, oh, and of course I'm worried about climate change, maybe just encouraging them to legitimize those concerns, essentially, what I say, I think would be the most important thing.
Yeah, and that was exactly what I was going to comment on too. There are a few students in our research group who are looking, they're speaking a lot with youth about climate change anxiety in particular. And that's one thing that comes up a lot, is that people are tired of being dismissed or gaslit about the topic. They want to be able to talk about it and have that discussion. And I do know, and Susan, you probably know the resource at the top of your fingers, but I know that there is a list of climate aware therapists that I've had many students comment on that is very helpful. So if you're looking for somebody to talk about these challenges specifically, there are certain therapists who have training in that area or have worked in that area who are great resources.
Yeah, and just, is that the Climate Psychology Alliance or, yeah.
Yeah, I was thinking that, yeah, I think so, yeah.
So Google Climate Psychology Alliance if you want access to such a list.
Thank you both so much. Next question is, are there any questions that we could routinely ask all people we provide mental health services to that might help catch some climate-related mental health challenges?
Yes, Sherry, do you have any thoughts about that?
I was multitasking and putting the link to that list
Thank
in
you.
the chat. Sorry, the question was about the limited evidence about the interventions. Okay, yeah. I mean, I'm curious to hear about what you think about this, Susan, but I know in the IPCC report, you had assessed the work that was done in Australia during the bushfires there in 2020, I think the year was. And the increased access to mental health services. They had increased telehealth to include mental health services during that time. They also had specific programming for youth during that disaster. So I think that things like that that are more related to extreme events or emergency situations, we probably know a little bit more about. I would say in the literature, there's less that we know about in terms of, positive supportive responses for things like climate change anxiety, for example. I have a couple students who worked on climate change cafes and talked to a number of youth in Canada and the UK about their experiences with that and how that helped support their mental health and climate change anxiety. And we've definitely found some promising results there from qualitative research.
Thank you. And was that, sorry, so there was two questions. Was that answering the question, of, is there anything that you would routinely ask, maybe like at an intake or if you're treatment planning, any questions that we would routinely ask clients to catch any climate-related mental health challenges that they might have?
I think that
Yeah,
I
I
had
don't
Did we answer that?
ahead. So yeah, Susan, go
That's
ahead.
okay.
I don't know that there are routine questions. Again, I think just making space for that. Some people are not going to be experiencing any of those questions. You can, and I am not a mental health practitioner, so I can't sort of speak from my personal experience, but saying something like, are there, while asking people about the kinds of things they're concerned about, to recognize that there might be things at that broader level, and it's not just what's going on in their home or what's going on in the job, but are there broader issues going on in the world that are concerning to you? I think that would be a good question to ask. And I don't want to appear to be hyping this, and I want to make clear that I do not get any money from this, but I do have this climate anxiety questionnaire that I know has been used in some clinical settings, so that's available.
And I don't have any examples of questions either, but I think part of it is being aware of it, and also being aware of how climate change can exacerbate or amplify past traumatic experiences. And there are two examples with published research on. One is from the Arctic, and it looked at how experiencing climate change was amplifying previous trauma from relocation and colonization. So during colonization in residential schools, people had loss of control, loss of culture, loss of language, put in unfamiliar environments, and that feeling of loss and control and the trauma around that was being re-experienced and revisited in the context of climate change, where landscapes are changing, things are unfamiliar, language is changing, that sense of loss of control and the injustice of it all was amplified through climate change. And another example of that, I'm working with a master's student right now in Alberta who is looking at people who are experiencing ecological grief and mourning, and a lot of people who are experiencing the loss of loved ones or are at end of life themselves. That grief and loss experience is like intertwined with ecological grief and mourning as well. So some of these things are very interconnected, and experience of climate change can bring up past experiences or can be interwoven in with other experiences as well.
Right.
Yeah, and if I could just jump on top of that, we certainly mentioned that that there are disparate vulnerabilities and disparate experiences associated with climate change, but we didn't, to a large extent, we certainly didn't say everything that could be said about that, and just the way in which some demographic groups have experienced historically displacement, for example, or historically increased vulnerability to climate impacts. So we have certainly redlining in the United States, for example. Those mean that they are going to be responding and going to be affected in different ways that we should be mindful of.
If I could follow up on that, one issue that comes up in discussions I have is the wide variety of use of terms. And there does not seem to be consistent definitions. So the people on the webinar, if you go to the literature, you'll find eco-anxiety used in lots of different contexts. And if you've got any comments to make on that?
I'm sure Susan has a lot of comments, because I can say that as somebody who has used the climate change anxiety scale that Susan has developed, and looking at the past literature, not only are people using climate change anxiety and defining that in a huge, like, wide variety of ways, even people who are using Susan's scale implement it and action it and mobilize it in different ways, taking different questions or different takes on it, which definitely I'm an epidemiologist by training. So the epidemiologist in me finds that it makes it really hard to do comparisons across time and place and space.
Yeah, And I wish they were, I wish we could sort of be more self-disciplined about the way we use language, but this is a problem in a lot of mental health. I mean, of course, you have all kinds of people talking about how they're depressed or they're anxious or even that they are schizophrenic in ways that are inconsistent with the clinical definition. So to some extent, I think we have to accept. And I personally, I would say climate anxiety could be defined as problematic, but I don't think it necessarily, just like depression, you can be depressed on a given day, but that doesn't mean you're clinically depressed. I would say the same about climate anxiety. You can experience climate anxiety without it being a clinical issue, but of course they're going to be associated. My own preference is to distinguish between climate anxiety and eco-anxiety because it's more specifically about climate change, but of course there's a lot of overlap there and people do use those terms differently.
The other thing I'm concerned about, based on some interactions I had with researchers in my university, is people using eco-anxiety or climate anxiety to refer to communities in the Arctic that are losing everything. And that is, from my perspective, just inadequate. That how do you describe losing the land your ancestors are buried in, where your ancestors have lived for 10,000 years? And that's a bigger issue than eco-anxiety. And helping people coming into the space understand, and I think Susan was one of your last comments about just the wide range of responses, maybe with Sherry, sorry, the wide range of responses, and respecting those wide range of responses, understanding labels are useful, but helping people think about which labels to use and not just use them blindly.
And that can actually be a useful clinical approach to, I think, to help people recognize that there are a variety of terms and maybe let them pick the one that feels most correct to them, because it can be helpful to one's mental health to be able to sort of more precisely say, oh, it's this thing. This is what I'm feeling.
Yeah, for sure. And I think, building on both of those last two comments and Susan's comment about that range of experiences, I think that, like, to be honest, experiencing a little bit of climate change anxiety is probably a good thing. I think it would be very odd or strange if you didn't feel a little bit anxious about what our future holds in the context of climate change. And there are people who write about climate change, feeling climate change anxiety is actually a very useful emotion or experience in the context of climate change. But on the higher end of that, when it starts to have clinical relevance, which is what Susan's climate change anxiety skills is trying to capture, that's when it's more problematic. It's impacting day-to-day functioning and ability and cognitive ability, and it's becoming more extreme. And those are the types of feelings and emotions and experiences that we need to be able to support and work through. So while climate change cafes might be very effective for youth or others to get together to talk about how they're feeling emotionally about climate change and how they're having feelings of anxiety related to climate change, it might not be as helpful for somebody who's experiencing clinical symptoms of anxiety related to climate change. And yeah, in the Arctic, I completely agree. I mean, the language around it all is completely inadequate, honestly, until you're there and you're talking to people and you're seeing the looks on people's faces when they're talking about these things. There are literally no words. When I was, one example, when I was doing my PhD, this is over 10 years ago now. This isn't a recent experience of climate change. This is, it was probably like 13 or 14 years ago. I was out with on the land with the hunter. It was in April, and we went to a spot where there was no snow. It was all moss. And he, like, the look on his face, he was just heartbroken. And when he was finally able to communicate to me why we had stopped and why he was mourning this, it was because usually there was snow on this spot until, like June. And the fact that there was no snow in this spot in April, it just meant everything to him. And there just are no words or descriptions to describe that loss that people are experiencing and feeling on a day-to-day basis a lot of the time in the Arctic.
I mean, that was one thing. I know we've said a lot. That was one thing that stood out to me. I think, Shirley, when you were talking about the grief and loss, something, that I didn't really think about. You may think of grief and loss temporarily, maybe, a fire, you lose something, you have to move, you go back, whatever. But the prolonged grief and loss, because your life, your environment, everything is changing. And this leads, I think, into a couple of questions that we have really quick to wrap up. I'm going to try and morph them together. So I apologize to people that asked these questions if they don't belong together. But this is regarding people who may be unhoused, migrating immigrants coming in. People are already seeing the effects climate change have on these people. And are there any recommendations how to support their work, outreach workers, people who work with these populations? Any advice to support their work, people who are seeing this directly, or anything that you have regarding policy changes? People are also talking about seeing arrests of climate activists and ever increasing immigration enforcement violence. So I guess just any comments regarding all of that as we wrap it up here?
As a non-mental health person, I will start while those who know much more about this come up with some cogent insights. Acknowledging and listening. It's extremely hard. I teach, so I hear from students of hearing their concerns and then turning on the media and seeing how politicians just deny their own reality. And that compounds the challenges they're facing. And Shirley mentioned finding ways for groups to get together and talk about this so that they can express their concerns. And that is important to start the process of how they're going to cope with this continuing change in our climate.
I have about another 2 minutes if anybody wants to dive into it.
I thought that was such a great way, like such a great note to end on. But in terms of migration related to climate change, this is not my area of research, and I know that it's an exploding area of research and lots of activity in this area. But I was talking to a colleague at the University of Alberta who does study this. And one thing that she's been looking at in the Canadian context is how there's no legal framework for climate refugees in Canada right now. And she's working on like the legal side of that, how we can make Canada a place for climate refugees to come when that sort of thing happens. I don't know what the situation is in the United States, and I'm not a lawyer, so I can't speak to it past that, but it is definitely a very interesting and growing area of research.
Yeah, and I'll just add that, talking about legal strategies and also talking about governmental action and the lack thereof are both important to understanding individuals' reaction, because one thing we know is a lot of young people in particular are reporting feeling betrayed by government inaction, and it's just heightening their feeling of helplessness and alienation in some senses. But also that to really effectively deal with this issue, we need to focus on those system-wide kinds of responses, both through governmental initiatives and through legal strategies. And it's actually quite nice to see many legal initiatives pushing forward.
Well, I want to thank you all so much for coming today. Thank you for your wisdom. Thank you so much for educating us. I wrote down a lot. This is so helpful. I am going to just briefly share my screen here just to say thank you, everybody. Thank you so much for the past 6 years. Thank you for being here today. And hope you have a good rest of your day.